Hi, I'm Jessica Fisher-Hattie with Attune Doula Services, and I'm here today to talk about what it will look like from start to finish if you have a planned cesarean birth. Your obstetrician might schedule a C-section or a cesarean birth for any number of reasons. Sometimes they're scheduled for breech presentation, repeat cesareans, the placentas covering the cervix, or other variations of pregnancy. It's important for you to feel prepared, especially if this is your first cesarean birth. So you'll be asked to arrive at the hospital 2 to 3 hours before your scheduled surgery time. If you haven't already, your doctor and pre-op nurse will go over the risks of the surgery and have you sign consent forms. You'll consent to surgery, to anesthesia, and go over options for blood products. Your medical history will be taken, along with current pregnancy information and information about any previous pregnancies or surgeries. You'll be dressed in a hospital gown, slipper socks, and a hair cover before surgery, and an IV will be placed in your arm or your hand. You'll have ID bands on your wrist that have your patient information, your blood type information, and any allergies that you have. Your pre-op nurse might have you wipe down your skin with antiseptic wipes, and your pubic hair might be shaved where the incision will be. Your temperature and other vital signs like blood pressure will be checked periodically while you're in pre-op. The anesthesiologist will come in to talk to you about the epidural or spinal or general anesthesia in the rare cases where that is used. At this time, ask them any questions that you might have. Keep in mind that if your surgery is scheduled and not an emergency, it could be pushed back or delayed by a few hours or longer if there's not an operating room available due to emergencies. You'll have been asked not to eat or drink anything after midnight the night before, and you won't be able to continue to eat or drink through any delays either. You might be given a preventative antibiotic or anti-nausea medicine by mouth or by IV as well. When it's time to go to the operating room, you can either walk in some cases or go on the hospital bed and they'll move you to the operating table when you get there. Your partner or support person will likely wash their hands and put on a gown, gloves, and mask while your anesthesia is started. Then they'll join you if your surgery isn't under general anesthesia. In the operating room, a heart monitor and its leads and a blood pressure cuff will be put on you and attached to the machines that they use to monitor you during surgery. The anesthesiologist will have you sit on the edge of the operating table to place your epidural. Then when it's in place, you'll be laid down and a bladder catheter will be placed. One or both arms will be laid out on arm boards, and you might be given medication in your IV to calm you. A drape will be hung in front of your face, and a high dose of medication will go into your epidural to numb you. At this point, your partner will likely join you, and they'll sit on a stool near your head. A nurse will prep your abdomen with antiseptic to clean your skin, and plastic will be placed over it with an opening for the area where your incision will be. The obstetrician will make sure you're numb, then we'll begin the surgery. Some doctors will have the nurse lower the drape as the baby is born so you can watch if there isn't a clear drape. You'll be encouraged to look up as they lift the baby for you to see for the first time. If you and the baby are both stable, some doctors will have you do skin to skin and initiate breastfeeding right there on the operating table if that's your plan. Others will have the baby swaddled and your partner or support person can hold them while they sit with you. After the baby and placenta are born, the longest part of the surgery begins where the incisions are closed and the surgery is completed. You might go to a recovery room for an hour or so or back to a labor and delivery room until it's time to move to your postpartum room with the baby. Your epidural will likely stay in for 12 or more hours to give you optimum pain relief. Once the epidural and bladder catheter come out, you'll be encouraged to try standing, slow walking, and a trip to the bathroom once you have feeling back. At that point, you can usually shower and change into your own clothes if you want to. Barring any complications for you and baby, you'll both stay in the hospital for 48 to 72 hours following your cesarean. Nurses will check your incision and your vaginal bleeding or lochia regularly to make sure that your pain is managed well. You might be given an abdominal binder or brace to wear, and you'll need to hug a pillow to your abdomen when you cough, laugh, or sneeze. You can read more about cesarean recovery at the link below on our blog.